to stabilize the other side because the jaw can deviate and move and all that. So then you're going to have your client open their mouth and you're going to get your finger in there and then you'll have them close it for this first round. And so, like mouth anatomy, I guess I could have done before I got my finger in your mouth.
It's like a dentist. Now
right,
you need to start talking.
Right? So you have, it's the lateral and the pterygoids. Mm-hmm. Is it lateral and medial? There we go. I was about to say internal, and that's not right. Lateral and medial pterygoids. And then you have the masseter, the big chunk and masseter muscle, and then the two pterygoids are the main ones that I massage, at least. So you'll go in at first, so go ahead and open back up and go ahead and close back up. So the masseter is the big meaty one, and you're just gonna kind of scoop, I'm gonna be doing this a lot going in and out, I apologize. You're just kind of scooping with your finger up and down. Wave at me, don't bite me if you want me to get out. Right, yeah. So, just give them that warning that they can feel free to wave their hands. I'll back off. I'll also give them spit or swallow breaks, not spit breaks, swallow breaks, breathing breaks, all that. So you just want to be very careful about their pain tolerance. So I'll go in here and go ahead and close your jaw.
Have you gotten bit before?
No. Not hard.
Oh, okay.
Not hard. So then we're just gonna follow along the meat of the muscle. When you feel it, like the more thin area, you're not really on the muscle anymore. Is that correct? Yeah. And then you also want to watch out for like the glands. Mm-hmm. Is that lymph glands and stuff there? Yeah. So you want to avoid things that feel too squishy or spongy because you're just gonna be mashing on things that
sensitive things that are not muscle.
So stay away from the like thin area and feel for the meat. And a way to feel for that meat is to have them do what she just did, which is to smile, and you'll feel that muscle tense up. And then of course you'll have them relax it as you're working on it. And so you start towards the top of the mouth and slowly glide your way down. And the thing about the TMJ muscles, like they're exactly like the rest of the muscles on the rest of the body, they're just wet, and that's the only difference. So you'll feel, same kind of tension, same kind of, you'll feel for fiber direction. You want to go in the correct fiber direction. And yeah, if you find something, hold it for a second. Work out the trigger points if there are trigger points if they're in there. And I usually do about 2 sweeps all the way down. It's a slower process because if you go too fast, then it's gonna
react rather than respond.
Yeah, and the jaw is so quick to deviate and all that you just want to really go nice and slow. It is going to be tender, so slow, kind of deep pressure. How's the pressure for you in there? Awesome.
Thumbs up.
And then, say I feel something right in there.
And this is a hooking. You're just doing
I'm just hooking. And really the whole motion in there is really just like this.
A glide, not a palpate.
Yeah.
It's very gentle and slow.
Okay.
And you are palpating as you go along. It's not effleurage, of course. So you're having to palpate kind of as you do your glides. Yeah.
Friction.
Yeah, and when you find something you can do, not really cross fiber friction, not anything that not anything that friction, and not the friction, but you can hold in place new static, yeah.
Now, are you applying some pressure with your thumb on the outside of the face?
Not really.
Okay.
It's just, because it looks better than that.
Right, yeah, it does.
And
it's better for your thumb, too.
Yeah, more ergonomics than anything. Cool. And I'm going to let you swallow and do your stuff. Cool. And then we're going to even it out. There's more moves.
Wipe my tears away.
Right, yeah. First client I ever had cry, I was doing this. I was like, yeah, cry.
Oh, I need to show you some stuff. You do not have to do that.
Please, all the torture. So then there are more moves that we'll do, but we want to keep the sides even. So now, and your finger is the only thing that got wet, so you can stabilize with the palm. You're not, messing anything up. And you go in here, go and close your jaw. And we'll do the same thing. And the thing about how like conventional medicine treats TMJ, they'll just like throw a splint in there, but what they're missing is that that's going to keep the teeth apart, yeah. But the pterygoids and the masseter are the thing that's straining so much. So you're just putting a stick in there, and the muscles are still going to be even more irritated, if anything. And that's why this is so good, because it's fixing the actual problem, which is loosening the muscle so that there can be room, because the muscle will lengthen, and there can be more.
I've even seen them do cortisone type shots. And
Oh
stuff
yeah,
in there,
it's
and
like what are you doing? Yeah.
Yeah.
In severe cases, they'll do surgery and reset the jaw.
Exactly.
Gosh.
Yep. It's like, why would not try massage just once or twice?
Right. Why not try anything else?
A little non-invasive stuff first, and maybe.
What's invasive?
Yeah.
Just saying.
Hmm?
It's invasive.
It is.
As she says it with a veneer.
Just saying.
Well, and I will say, like, I did a lot of research about TMJ stuff, or different clients that have gone through the turmoil that is, severe chronic TMJ pain. Because there's not like one thing that always causes it. Like braces can cause it, sudden injury can cause, like so many different things can cause it. But a lot of people every single time will mention massage is one. Like maybe it's not the only thing, but as soon as they get the massage, they instantly felt some kind of relief. Even if it wasn't 100%, you feel it so instantaneously. You're doing okay? Pressure on this side?
Mm-hmm.
Okay. So then that's the kind of
Definitely the tighter side.
Yeah. For sure. I kind of wiggle it out. All right, and so then we'll go back to this side, or you could start whatever side. We'll go back here. And now what you're going to be doing is getting up into the joint. You're going to be feeling for like a pocket, I guess is what I want to call it. It's where the your mandible and your temporalis meet.
Okay.
Am I saying that right? Yeah, temporal. Thank you. I was like,
That part up?
That's what I'm thinking.
You're going all the way back to the back of the teeth, straight back, and then you'll kind of just feel up in there. Jaw will be open, so it gives you access to it.
Is this, are you right in the jaw socket, or are you lateral, or so medial would make them choke? So are you lateral?
Oh
or
yeah,
in the,
lateral.
Sorry,
All of this is lateral.
I do
Yeah.
have a gag reflex, just like
Yeah, you go to the back of the teeth, and then you slip off laterally.
Back of the teeth, your fingers, stay against the wall of the mouth the entire time. So yeah, you're lateral of the teeth.
So you're in between, basically you're in between masseter and the pterygoids.
Yes, thank you. I haven't.
You're welcome.
Yeah.
She would say it if she didn't have her fingers.
And go ahead and open your jaw. All right, and then, you're feeling. Where am I? I'm in the pocket, and that's all I've called it because that's all that I've done.
It's literally in between.
Okay, right.
The masseter and where the pterygoids.
Yeah.
The jaw, so you're like right in between that space, and you're affecting now your pressure is going backwards, which is kind of again separating out the masseter from the pterygoids because they get really sticky. They get really stuck with fascia.
And
so,
I do like my pressure will be back, and then I'll move lateral a little bit.
Yep,
Pull them right off. Huh? And
hit that trigger point.
Right, yeah. And this is like the most sensitive part of the TMJ massage. Is when you're right there between the pterygoids and the masseter. And you so what I was taught is you go back, you can pull out, and then you're gonna get into the V shape of the mandible. You're gonna go up and then
come across.
Yeah, you're gonna work every angle of that
pocket.
Yeah. So we're gonna go back in and keep your jaw open.
We'll get Dr. McCoy over here so we can show him on a skeleton what we're talking
Yeah, I was like I'm
We're
just.
Trekkie fans here. That's why we call him Dr. McCoy.
I like it.
Wow.
Do you need me to back off? Okay.
He's here on Sundays because he's a skeleton. Oh, okay. Dr. McCoy. Dr. McCoy is Star Trek.
Oh, okay. She's like, why is he here on Sunday if he's a doctor? Sorry.
I thought it was
I had to make something comical because you're on a trigger point or something.
Yeah.
Look, Dan, somebody besides you makes me cry.
Yes. Badge. What?
Do you guys do this too? This kind of massage here?
Yes. Yes. We have David do it in clinic. In
Nice.
our shooting clinic, yeah. Okay. So, right behind, we've got the jaw open. She came in here, and she's on this portion right now. So the masseter is attaching out here, so she's in between the masseter and the pterygoids are all in here. Okay, all these places are pterygoid attachments. So she's working, she first did this, pushed apart on the side, right? And now she's right in this space, she's trying to separate the masseter from, right?
Was that a release or was that you moving?
Oh, that was such a
Fucking
fucking
cool release.
So then she said
sorry,
she's
that was
gonna
really
be doing it.
exciting.
She's coming up this way, she's coming up this way, she's gonna,
And then
she's
we'll go
working
and
this
do
whole,
side.
this whole section here, so she's working it from every angle. So,
This is awesome.
so Dr. McCoy.
I love Dr. McCoy.
He's the real McCoy.
Yes.
Oops, sorry.
Oh,
Yeah, this
never
is
say
definitely the
sorry.
teeter.
We never say
What,
sorry.
right.
Did you guys know that, right? Never say sorry.
Never say oops.
Yep, never say oops, sorry, because
Oh my
it's
God,
an
I never
admission.
say
You're
sorry.
liable.
Yeah,
You're
there you go. You
liable.
should never say it because then it means that you have actually done something wrong to be
Right.
sorry
Oh.
for.
Yes.
So, I'm sorry that hurts you. Is one thing you can say, but you're definitely not admitting guilt and saying I'm sorry.
Just, is that uncomfortable or something?
Yeah. You handsome devil.